Hello, my name is Jacob Busen. I'm a student of the University of New England. This presentation is over Pathophysiology, Module 1, Key Terms and Concepts. This is a note card with my name and the concepts I will be talking about. First, the definition of a disease is an acute or chronic illness that is either genetically inherited or environmentally acquired that causes dysfunction in one or more body systems. An example of a genetically inherited disease would be cystic fibrosis. This causes the mucus to thicken in the alveoli in the lungs, and it blocks the alveolar ducts. This causes breathing to be more difficult. The primary system impacted would be pulmonary. Bacterial pneumonia is an example of an environmentally acquired disease when bacteria enters the lungs, causing alveoli to fill with fluid or pus. Oxygen supply decreases in the lungs, and therefore decreases in the blood cells and cell tissue. Primary systems impacted would be pulmonary and cardiovascular. Disease classification can be based on many things. First, it can be genetic or environmental. It can be chronic or acute. It can be based on the signs and symptoms of a disease or the etiology of a disease. Furthermore, it can be classified on the pathogenesis or the morphological changes that occur with the disease. Etiology is the cause of a disease. For example, sickle cell anemia is caused by a single mutation in the hemoglobin beta gene that causes the normal structure of a biconcave red blood cell to transform into a sickle cell structure. Pathogenesis is the evolution of a disease. An example of this is type 2 diabetes. When insulin resistance develops, this leads to hyperinsulinemia and damages the beta cells, which then produce decreased amounts of insulin, which causes hyperglycemia. Signs and symptoms are often confused. Symptoms are subjective. They're what the patient is telling you is happening, and it cannot be measured very well. Examples of this are pain, headache, nausea, dizziness. Signs are what can be measured by someone who is not the patient. This is temperature, swelling, inflammation. Syndrome is a collection of signs and symptoms characteristic of a disease. An example of this would be irritable bowel syndrome. That targets the large intestine. Signs of the disease would be gas, constipation, or diarrhea, and the symptom would be abdominal pain. Diagnosis is the determination of a disease or the cause of a disease. An example would be a patient goes into the doctor's office and has a sore throat and complains of a fever and a headache, and the doctor sees signs of tonsil swelling and redness. He or she may tell the patient they have strep throat, a bacterial infection in the throat. Complications are adverse effects that occur due to the disease or the treatment of the disease. An example of this would be cancer radiation treatment. Radiation kills the cancer cells, but it also may damage healthy cells around it as well. It can cause a host of issues dependent on where the tissue is located that they're trying to kill. Prognosis is the likely outcome of a disease, or the likely path and outcome of a disease. An example would be HIV. When infected, it kills your CD4 and T helper cells. When they become critically low, it's classified as AIDS, and at that point, basic infections that would normally be, you might not even notice, such as the common cold, they can become fatal. Diagnostic tests are tests that determine if you have a disease. Examples of this are ECG or EKG, CT scans, and blood tests, such as the H1C test for glycinated hemoglobin to see if someone has diabetes. Also biopsies are another diagnostic test. This concludes my presentation over Term 1, Module 1, Key Terms and Concepts. Thank you for watching.